doesn't have to be.
Exactly.
We do a lot of things to help it be a comfortable, painless procedure.
Yes.
We offer people topical numbing cream.
Mm-hmm.
We try to inject at a pace that's comfortable for them. But I think most people are pleasantly surprised at how comfortable the procedure really is.
We can, again, cater it to whatever the patient's comfortable with. You know, there are some patients that do want it to be obvious, but most people want it to be a very subtle change.
Yeah, I feel like if we've done our job correctly, that it should be very natural and people shouldn't notice. You should look nice, you should look better, but you shouldn't look like you just had filler. I think we hear that all the time. People have seen someone on TV who they think looks very unnatural, and they don't want to look like that person, but it scares them away. But really, when done correctly, you should look natural. So what you see on TV is sometimes the extremes, and really what we're trying not to achieve. I had someone earlier who her concern was that if she had filler, it would make her look fat. And I couldn't help but think she has seen some people on TV who are a bit overplumped.
Yeah.
And that's what gave her that misconception. We frequently combine surgeries, and it's you have to evaluate each patient, make sure they're an acceptable surgical candidate. But as long as that's the case, you can safely combine. You certainly can, and you should, have mammograms after a breast augmentation. But the technique is slightly different. So everyone that has a mammogram fills out usually a questionnaire for the staff. And so the technique is different if somebody has an implant in place, but you can still effectively perform the mammogram. I usually recommend that after a breast augmentation that you come to see me once a year for just an implant check. Usually with physical exam, we can tell that the implant is intact. Sometimes we may want to do additional studies if we feel that is indicated. But more often than not, if a patient needs their implants replaced or refreshed, it's really to keep everything looking as nice as possible.